I had no concept that I had lost that half of my face, at that moment. I was supposed to be day surgery, this complication wasn't supposed to happen, and no one knew what to do. My family, unfortunately, was in a waiting room with no one to help that day for them to know why the surgery was taking longer. So I think that added to the stress, added to the anger.
And the fact that nobody could really connect how it is that you could go from being relatively healthy, able to walk 6 miles, going in for what you understand to be a relatively routine surgery, and suddenly days later fighting for your life without any explanation is traumatic. I feel like in many respects that what happened to me would be the way I would treat roadkill. I mean, feel bad but keep moving.
The culture of medicine and surgeons in particular is that you don't deal with it emotionally. Those are one of the things that happens, and it's sort of like, you fall off the horse, you have to get right back up again. I felt like I couldn't talk to any of my colleagues about it. In fact, I felt that they were shunning me. I got to be sort of hypervigilant, I had trouble sleeping. It was a very difficult time.
MITSS is a grassroots organization. It is regular, common people just like all of us. It is, our brothers, our sisters, our parents, our children. It is everybody. What they wanted was they wanted people to hear their stories, and they wanted people to learn from their stories.
They're not there as to legally represent the patient. They're really there to identify that a traumatic event has occurred. It's had an impact on an individual or group or family, which results in dysfunction, and it needs support. Coming at it with the goal of helping healing has been essential to MITSS' success.
I'm very lucky. I found MITSS between 6 and 8 weeks of my experience. Sometimes, although your family wants to be supportive, they're also dealing with their own grief, their own anger. And thankfully, because MITSS became part of my life, I just felt like I do have a good support group, and you're not alone.
It's only when you get a little bit better that you can relax enough to actually, I think, take in some of the psychological and emotional trauma. What was wonderful about talking to Linda in particular was that she knew so much more about what I would ultimately be going through that I didn't even understand at the time. So they have a 10-week program. They cover all kinds of topics. As it turned out, all those topics are really relevant.
What helped me the most was finding that I was not the only person. Before we both started to find MITSS, there was no one to talk to. I had no outlet for all of those frustrations, and I'm glad that there is an outlet. I'm hopeful that we can, spread the word even more.
Healthcare organizations and hospitals are very complex, and they have their own cultures, their own ways of doing things. What's exciting about MITSS is as it's matured and developed, it's becoming a partner with organizations to actually help them change.
As we're looking at these malpractice cases and trying to help doctors and nurses and other providers learn from these malpractice cases, we were understanding more and more that what needed to be listened to in these cases was the voice of the patient. Suddenly we found ourselves with the perfect partner. Linda and MITSS have been so insistent that here is the voice, listen to it. Make sure that the voice of the patient is in your committees. Make sure the voice of the patient is helping drive initiatives that are hopefully going to make healthcare safer. Because we've been able to do that, many malpractice carriers across the country have followed suit, and I think it's been a very successful kind of effort to break down those barriers.
And one of the things we really need to focus on is restoring that trust with his providers. That definitely has been affected by the medical error that occurred. And that's where MITSS can play a really important role.
What we've begun to do is offer educational programs to physicians, residents, nurses, chaplains, social workers, and to encourage them to consider a referral to MITSS. Those individuals will think more about maintaining contact with those patients or families, and then doing follow-up with them and reminding them again, weeks or months later, of the availability of the services of MITSS.
We all recognize that it was the right thing to do, and if we want to be a leader in patient safety, then we have to take it all on. MITSS is part of that, patient-family relations, social services is part of that, the attendings, the physician team. It's become part of the process. The disclosure, apologizing, making sure that everybody has the right support and resources available, that they know where to get them. It's part of life at the Brigham. I think it's part of life in healthcare.
You look at the growth of Linda's organization and its influence over the past several years, it is stunning.
Linda clearly has the interests of both providers and patients at heart, so that she isn't someone who is merely a patient advocate.
I have probably a different view than everybody else to patient-centered care. I believe that we need to go beyond that. We need to go to people-centered care, because you have happy employees, their needs are being met. That spills over to the work with their patients.
With the influence of MITSS, many of our organizations and many organizations across the country are now integrating much more robust support programs to make sure that providers are well taken care of after these terrible things happen, and they've been involved.
It turned out that there were a lot of doctors and nurses and pharmacists and others that were very ready for this mission. Linda has tapped into that, and it will continue to grow.
MITSS is a place that gives me courage, that shows me the way of where we can go. They're getting ready to publish a report that not only speak to the evidence around the toll that this type of tragedy takes, but it also introduces new interventions that are now being implemented around the country and around the world. IHI is going to make sure that the world knows about this report.
Thank you for calling the MITSS office. This is Erin. How may I help you? And could you tell me a little bit about...
MITSS has been doing amazing things with very little staff, and we have lots of volunteers. People just really believe in the mission, want to give their talents.
I came onto the MITSS board as a representative of the nurse leaders in the state. The people on the board I would describe as passionate about compassionate care. They are patients who have been impacted by adverse events, physician leaders and experts in their field.
They all have a part in the big landscape of patient safety and quality within Massachusetts and beyond.
At the end of the day, it's the same goal, that everybody is trying to get at the same place.
It was the passion for the cause, and that something changed. And we know that can change the world.
You know, Lucian at a board meeting once said that basically what MITSS is trying to do is eventually put itself out of business. When every hospital, as a part of doing business, has an emotional support mechanism for both the clinician and the patients and families when things go wrong, whether it's an error or it's just an unanticipated outcome that nobody could have foreseen. When that happens, we've done our job. Until then, we have a lot more doors to knock down.